It's going back. It's like I was just doing fine, and I try to look at it like, so that's one to box. 24/7. So on the shower curtains, are we giving them or we to shower curtains? Yeah, got her there. So that all the time, I did say it, but you said we do. That's all they showing it, and so what's wrong with it? So, building. So, last time we had that problem, they got them another. I'll give you an answer. Yeah. 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 So, All right. Well, um, Morning, Dr. G.
All right, good morning, everybody. Sir?
Let's do this.
Yeah, let's do this. So we're going to get going here pretty quickly. We're going to just a few little housekeeping things. We're probably going to be shutting down just a little early this morning because I have on Thursdays we have a clinical meeting that I have to attend, and so not maybe 10 minutes early, something like that. So today we're going to be talking about HIV and AIDS. This is goes along with our physical health and recovery. So everybody needs to make sure that you sign off. Lieutenant bringing you your paperwork. Make sure you sign off on the right one and get that turned in. And everybody has to have their book in class, and we're gonna go over that just a little bit this morning, and then move on into our study of HIV and AIDS. This is a little bit different this morning. It's more of an overview. We usually do a real deep dive on this. I'm not going to do that today. It's more just kind of an overview of the disease, what it is, what it isn't, where it's going, and some things like that, how to get tested for it, and all that kinds of stuff. Excuse me, someone from Buna, Texas, calling. No one is Buna, Texas. So, if you have your book on page 21, it tells us that once we get to the place where we've got all of this stuff lined out and we've figured out that, hey, we really do need to get into a place where we are in treatment, not in treatment, but we are doing something physically to help ourselves and get our health to a good place. We get to that place, today we're looking at taking action. All of the plans in the world, even though they're the best plans formulated, the best thing we've ever come up with, they don't do any good at all if they're not activated. So everything that we come up with to do some good for our physical health and stuff like that has to be first actionable. Actionable means it's doable. I can do it. Secondly, they have to be, we have to be the ones to take action on it. So you've already begun taking steps to improve your physical health, but we don't really practice it consistently or gain a state of maintenance. And that's where we're headed for, that state of maintenance. And what that means is I'm in fairly good shape, and I'm going to work at staying in fairly good shape. Right? And so part of this, look, part of the study this morning, when we're studying, we're taking a look at HIV and AIDS, is part of that. We need to make sure that we are working to keep ourselves in good shape. Now look, this is, what's the guy this morning?
Sick.
He's
sick.
Yeah, he's not feeling really well. He doesn't know what's going on. He may have some venereal disease, as Joe pointed out. He could have some. He might have HIV. He might have, some STD or something like that that's going on. He's not quite sure, but it's also showing us that back in the day when someone had a diagnosis of HIV, then their worldview was this, right? And this is a what? It's a graveyard. Yeah, this is where dead people go, right? This is where when back in the day, that's what it was. But you know that back in the day, way back in the day, if you got a diagnosis of syphilis, it could be a death sentence, right? Before they came up with penicillin and stuff like that to help take care of that. I had somebody in the last class that we had that said syphilis was what? Couldn't be cured, uncurable. That true? No, it's not. It can be cured. If you know that you have it, you know you've been exposed to it and all of that kind of stuff, and you go to see your doctor just right away, one shot of penicillin will kill it. One shot of penicillin will take it out of there. If you wait for a reoccurrence, what happens with the syphilis is it goes away, hides, and goes to sleep in your body for a little while, gets into remission, and it can stay there for 10 years or 15 years and then show back up. And at that point in time, it's been in there long enough to ensconce itself into your system pretty well. And so now you're still treated with penicillin, but it takes at least 12 shots on a month for a year. Yes, sir.
Is that the one where they, when that shit happened to them, they have spots on them and shit?
Yeah, they have a little thing it's called a chancre, and that's a little white looking sore that will pop up and come up on your body in different places. And so, when that happens, you need to go to your doctor. But here's the deal. This is what a lot of those do. The reason I brought that up is that even the other diseases that we can get taken care of just with a shot or something, back in the day were death sentence, right? They're not that anymore. So we can just go get a shot. Now, HIV and AIDS is not that. Y'all having a good time over there?
We had something about this stuff.
Okay. Well, you did, yes. So, so it's not that anymore. HIV is not a death sentence anymore. It's not a good thing when you get one of these diseases, just like anything else. When the doctor tells you you have diabetes or cancer or anything like that, it's not a good thing, is it? No, of course not. But it's not necessarily a death sentence, is it? It can be treated and people can live long and productive lives. So this scenario is not necessarily in action anymore. The other one over here is more like it. We have a clear field where we can do something. But the thing is, we need to be in action about it. When we figure out that we might have that, we have some actions in our own life, some behaviors in our own life that make us more susceptible to maybe getting the disease. What do we need to do? We need to go get checked. We need to make sure that we're getting checked. Look, you can go get a check and figure out whether that's in your body or anything like that, and then you can begin to work at defeating it. And you're not going to defeat it, but you are going to be able to live with it. So this is not what we're going for. So this morning, we have a goal of learning how to deal with HIV and AIDS and other STDs. Okay? So this morning, what I want to go over real quickly, like I said, this is more of an overview of the drug. I mean, not the drug, the overview of the disease. So I want to go over it pretty quickly. This is not that deep dive. We've done that 3 or 4 different times. So these are some of the main questions about HIV, and we want to just take a look at those things, all right? So if you have questions or comments or snide remarks, let's do those things. So we have a few key terms that we can be helpful to know as we're starting and sticking with treatment. If we're into a place where we're in treatment, we need to know how we're going to carry that forward, all right? So being in treatment today, in treatment for drugs and alcohol, right, that means we need to get tested for STDs or drugs, or HIV and stuff like that. Why is that? Why do you think?
Behavior.
Yeah, because of our past behavior. When we use drugs or alcohol, we're not doing the best thing for us, right? We're at that place where we may do something that's going to lead us to having one of these dread diseases. And so we need to go find out if we've got that. If we're unsure at all, we need to make sure of that. So here's some questions. How long can you live with HIV? How long? Not long. We got not long. And what did you say, Mr.
For the rest of your days, you got to write medication.
got the right medication, okay, we're gonna live for a long time. All right, here's the deal. Back in the day, when we got a diagnosis of HIV, it was a death sentence because we progressed from HIV into AIDS pretty fairly quickly, and sometimes it would take a little while, but sometimes it was fairly quickly. But when we progressed to that place of AIDS, we were dead. You don't have much time after that. What kills us when we get into that place?
Other disease.
What?
Other disease.
Other diseases, yeah. All that the HIV, all that AIDS is doing is destroying my immune system. It's getting my body to the place where my body can't fight off opportunistic diseases. What's an opportunistic disease?
Like a common cold.
Yeah, something that'll jump on you just because. If you come in here and somebody got a cold, you may get a cold, right? Because of the virus, and it'll jump from one person to the next. If somebody has pneumonia or something like that, if they have the HIV virus within them, it makes it really hard for them to fight that off. And if you have progressed to the place of AIDS, then it's going to make it almost impossible. Well, it does. It makes it impossible for your body to fight that off, and you die from that. So usually we're going to die from pneumonia. Pneumonia is a big thing that gets people who have progressed to that place. There's also several different types of cancer that when we progress to that place, that gets you pretty quickly. And so it's you can live a long time nowadays, but today's treatments make it possible for people living with HIV to live longer and to live healthier lives. I've told you guys a couple of times that I had a lady that was a client of mine years ago. When I had her as a client, she was 23 years old. She contracted HIV when she was 13. So she'd already had it for 10 years. And
blood transfusion?
Say it again?
Was it a blood transfusion?
No, it was semen transfusion. So she was having, is it any surprise that a 13-year-old girl's having sex? No. There's I know 8-year-olds and 9-year-olds and, children having sex. So, yeah.
You say she contracted it when she had had it for how many years?
Well, she was 13 when she got it, and when she was my patient, she was 23. So that's 10 years.
Okay,
my lightning quick mind pops to that 23. So that was probably 30 years ago. So she's an older woman now. But she, at that point in time, had 3 children, married, all of this kind of stuff. So what that tells us is that her life was progressing the way that her life should have been progressing, right? But still, this HIV thing was something she had to deal with on a daily basis, right? Her husband was not infected. All 3 of her children are not infected. So, it is possible to have this. The HIV is not the death sentence that it was when we first had it out there. Right? It's different nowadays. It's something that is manageable. It's not something that is curable. Something like the disease that we have, which is not curable, but is manageable. It's meant to go and come together.
Yeah, like I said before, I know people in here, so say it again. I know somebody with father, the husband and the wife had, she got pregnant and the baby was born HIV free.
Yeah, and that's usually the case.
I was just gonna see if I could get some water and maybe get a fan or something. I'm still real hot.
Yeah, sure. Get you some water, and I don't know about the fan. I don't deal with the fan. So today's treatment make it possible for us to live longer and all of that time and healthier lives than at any time in the past. Now that makes sense, right? And I will tell you this, that I do believe that going forward it's going to get better, right? When this first started, we didn't have anything to fix it. We didn't have anything to fight it. And so people were dying left and right. But now we have so many drugs and stuff that we can use those to fight the disease and keep it in remission for longer and longer and longer. People are living between 40 and 60 years with HIV. That doesn't mean that, hey, it's a nothing. It's just like anything else. We don't want to get that stuff. You know, when my doctor told me that I had HIV, not HIV, my doctor told me that I had diabetes. Um, yeah, okay, that's not a good thing. He said, yeah, it's not a big deal, but here's the things that can happen to you. And he went through a litany of things like you can lose your limbs, you can go blind, you can die from all of these kinds of things that's going to get me if I don't get off sugar and do all the things that I'm supposed to do. And so it makes life a little more unmanageable. And so I don't, I'm really not happy that I have that. And I'm praying that God will take that away from me at any moment now. But this HIV is the same way. It just because it's treatable doesn't mean that it's okay for us to have it. Doesn't mean for us to, it's okay for us to remain in the behaviors that's going to cause me to probably get it, which is like having sex outside of marriage, having sex with many bunches of people, and we'll be talking about that a little bit, and using needles and stuff like that. There's all sorts of things. So I need to avoid all of those things that's going to cause me to get it if I can. Say it again.
Not using the condom.
Not using the condom, all of those.
Some of it can't be avoided, but I'm quite sure now they put God out of regulation, and some people have got to get blood transfusions.
Yeah, well, there's not anything that can't be avoided when it comes to this. In transfusions in the United States, people back in the day have gotten it through that. It's impossible to get it today through a transfusion. Your blood is treated and it's tested before they treat it. And then if you have it, they're not going to use it. Even if it's not in the blood, they treat the blood anyway. So the blood that you get from a hospital here in the United States does not have it. Now, if you go to a third world country, that's different. Yeah.
Oh, and I also know they got contracted with unclean dental equipment.
Unclean dental equipment. Well, perhaps again, perhaps in a third world country somewhere, not here. Not here. You're not going to get that. It's almost, first off, it's almost impossible to get it that way because you can't get it through close contact or kissing and stuff like that. You can't really get it from that. It's not transferable that way. And here, when's the last time you've been to the dentist?
Last week.
Yeah, I know you can't remember. Yeah, but they not only sterilize things, they throw stuff away.
Right.
Most everything, every little thing that they use gets thrown away. When they do the drilling in your teeth and stuff like that, they don't throw their drill away, but that tip goes away. That thing comes right out of when it comes out of your mouth, it goes into a sharp box, and they don't ever use it again. So here, we've done the things, the medical people have done the things to keep from transferring that stuff. You go get, tattoos? You go to a real licensed tattoo parlor, and they're the same way. They have to throw, when they do your tattoo, the needle that they use to give you your tattoo, they has to go in a sharp box and it's thrown away. For the same reason. Now, if you did that out at the guest unit, that don't count. Because that don't get thrown away. So anyway, there's a whole lot of things. People living with AIDS can have relationships. We can raise families, pursue life goals, live their lives because they're not guaranteed to die. A lot of people that contract HIV today are going to live long, productive, happy lives and die from some other disease or from just old age, live to be 80, 90 years old and have that virus in them. It makes your life a little less manageable because when I'm going to go out to eat or something, I have to be cognizant of what I'm doing. When I'm going to go traveling, I have to be cognizant of what I'm doing. One of the things that this lady here, when she was in treatment with us, one of the big things with her is being able to be near her doctor. She needed to be near her doctor so that she could, when same things happen, she could be with him. Here's the deal. If for some reason you figure out you've got it, it's never, ever, never too late to start treatment. It's just like with with alcoholism, it's never too late to start that. With drug addiction, it's never too late to start treatment. With any kind of disease, congestive heart failure, or diabetes, or cancer, or anything, it's never too late to start treatment. We don't ever want to get to the place where we say, okay, we've got it, that's the end of my life. That's not true. That's not true. I tell you, when the doctor first told me I had diabetes, I would slap him upside the head. You know, because look, I don't want that. It causes complications in my life. I will tell you today, y'all know I'm in recovery from sugar. Today, now I relapsed not too long ago, but today, this day, right now, Thursday, the 6th of November, I'm on my third sugar-free day. I started back over, so I'm on my third sugar-free, and I will tell you, just from having 2 days of being sugar-free, I feel 1,000% better because my sugar level is coming down. Yes.
Inquiring minds want to.
Okay.
What you gonna do in a couple of weeks?
What am I going to do? Well, my plan is at this time, and the best laid plans of mice and men go awry, but my plan at this point in time is I don't ever want to put any more concentrated sugar in my body. Now, you can't eat and live without sugar. It's going to get into your body in some way. I'm going to be eating some snap beans today. There's some sugar in there. There's some sugar in there. Not a lot. There's a little bit. I had a power drink a couple of days ago. It had a little bit of sugar in it, not a lot. But the thing is, I'm not getting concentrated sugar. I'm not going out and getting a moon pie. I'm not getting a big old, those honey buns with iced honey buns.
What about soda?
So what
Soda.
I haven't drank a soda in probably 10 years. That's a Coca-Cola is concentrated death. And so if you drink that stuff, man, golly, stop. Mr. Farmer, I keep poking at him. He drinks it all day long, every day. He drinks Coke Zero, but that's not any better for you than Coke. So that's just 90% sugar. So don't drink that mess. And diet is just as bad because they put other stuff in there.
Okay, since you evaded the question and answer, I'm gonna break it down to layman's terms. You got the holidays coming up. Your daughter's cooking.
Right.
So you're not going to eat none of them first. No pumpkin pie.
No. My wife and
I. Not gonna work.
Look, it's holidays are here. I mean, it's November. Thanksgiving is coming up, right? And then Christmas is right behind that, and then New Year's is right behind. I love this time of year, and I tell you, it's funny. I drive to work. It's still dark outside. It's getting a little light now because of the time change, but it's usually dark outside, and people already have their Christmas lights up. And I'm thinking, wow, that's a little early, but there you go. They got the Christmas lights up already. But my wife usually cooks this huge meal, and it's all turkey and dressing and potato salad and corn casserole, and oh my God, that stuff is good. She's not cooking this year. She decided she's at a place where she's not eating that kind of food anymore, and so she also made 2 or 3 pies, and she's not doing any of that. So we're at this point trying to figure out whether we're going to go to our kids' house. We have kids that live in Normandy, and then we have kids that live down here in the South. So we got to figure which one we're going to, and if we're not going to go to either one of those, we're going to go to a restaurant. And what we're going to do is go have a piece of turkey and a little dressing, and then that's it. We're not going to all of the stuff that we usually eat. Just because it's a holiday doesn't mean I need to kill myself. So we're serious and getting older and having issues. So we're seriously trying to figure that out. What's really going to make the determination is whether or not I just came on full time here a couple of weeks ago, and on the 27th I came on full time, and my time off and all of that stuff started from the 27th. So I may not have, and they're looking at it today. I just talked to my boss about it. I may not have time. I may be here on Thanksgiving. And that's okay as well. Doesn't matter. I'm sure the chef or whoever's here, y'all gonna have some turkey or something, and so I'll help y'all.
I'm planning on cooking turkeys.
All right, there we go. I'll come help you.
I just got one question.
No, you don't have one question. It's so far as the 13th.
You've been running around the block. I heard the question anyway. People I want to know. So you telling me they literally don't have a class on Thanksgiving Day, River?
I don't know. We are never closed. We're open 24 hours a day.
But I'm saying you don't have a class.
We don't close on the holidays. So we are going to do something as far as treatment is concerned on the holiday, because the holiday doesn't shut down treatment. So we're going to be here. I know that Miss one of your counselors, Miss Casey or Miss Charnel one, and over there at North, same way, is going to be here. And then the next one of them will be here for Thanksgiving. The other will be here for Christmas. And that's
well,
okay.
I like that because I didn't stop drinking on holiday.
No, I didn't either. I got a little bit better with
more.
it. So we will be here. What we're doing, I don't know. We will have some good food on those days, I guarantee. And then on Christmas, we'll all get a red nose to wear. We used to do that at the prison. We'd go around and we'd pick some guys out. We'd try to find the biggest, meanest guy and make him wear this red nose. And look, there was a little gal out there. She weighed about 90 pounds. I'm not going to make some big dude wear it, but she would. She'd go, you got to wear it. And she'd get him to wear that red nose, and we'd sing Rudolph the Red-Nosed Reindeer. And then we'd sing that song about that girl we're trying to pay off. What's her name? Phyllis. Y'all know the girl we sing about every year, Phyllis? Y'all hadn't heard this? Come on, Phyllis Navidad?
Feliz Navidad.
Phyllis Navidad. It's Phyllis Navidad. Come on, dude. So it's never too late to get treatment. Okay, it's never too late to get started. But it's important once we get started into treatment to take good care of yourself. Once we figure out, hey, I've got HIV, or hey, I've got this disease, or I've got that disease, no matter what disease it is that you have, even addiction, which is what we have, and some of us have other things as well. We got another client that came in this morning or yesterday, and he has diabetes as well, and he and I compare notes a lot. But the deal is, if whatever it is, it's really imperative that we keep ourselves in good health. If I'm healthy, if I'm exercising, if I'm dieting, if I'm eating the right types of food, and I'm getting enough sleep, then I'm going to be able to deal with the disease 100 times better than somebody that doesn't exercise, that eats the wrong foods, and only sleeps by, naps every now and then. So getting in good shape, even though, I've had people tell me, well, I have a disease that's going to kill me, so there's no say. Yeah, no, there is every good thing for us to get to the place where we're exercising on a daily basis. I just went through a study that said that it is very, very good. It's very good for people who are getting older to do weight training. So as you grow older, some of you guys are, younger than my socks, so as you grow older, you need to begin to do some weight training. That doesn't mean that you need to go to the gym and become Arnold Schwarzenegger. I go over here to the gym. There's a couple of guys over there that, man, they're advanced bodybuilders. But there's also a couple of guys over there who, their arms are about that big around, and that's fine. They're not there to become the next Arnold Schwarzenegger. They're there to do some resistance training that's going to help them stay in better shape. So, and some of these guys are fairly old, and so as you get older, you need to do that. I was working out one day, and there's a guy there. He was at that time. This was several years ago. He was about 10 years older than me, and he was 75. So, I asked him, I said, hey, you know what? Why do you think we keep doing this? I just trying to strike up a conversation. And he said, well, I do it to stay alive. So, okay, that's a good point, and that does that. Whatever disease that we're suffering from is made more manageable if I'm in good health. Right? How many people, look, why do I work out? Why do I eat? Try to eat well? I'm not the best at that. Why do I get enough sleep? Why do I do all of those things? Because I really like to feel good. At one time, I was a little bit overweight, and I will tell you this: that I felt I was miserable. I just can't do it. I was miserable.
So but I was a lot of it.
Yeah, you were a little overweight. So as I exercise and get myself in good shape, I just feel better. And isn't it better to feel better?
Absolutely.
We want to feel good. We want to feel good. How will you feel? Yeah. You know what it is? It's the goatee. The goatee is pulling your face down and making you feel bad. But that's just so you know. So HIV, look, is livable. Just about every disease that's out there, we have made so many advances in healthcare that just about every disease that's out there is livable. We can do something about it. Y'all heard about Mr. Cheney, used to be the vice president, just passed away at 84 years old. You know that he had a heart transplant? He had congestive heart failure. He had 7 heart attacks in his whole life. He 34, he had his first heart attack, and then he began having heart attack and heart attack. So he's one of the first people that they took his heart out and put a mechanical pump in his heart, in place of his heart. And so he's living. I cannot imagine that, living with a mechanical pump in your chest instead of your heart. And how do you fall in love with a mechanical pump? You have to fall in love with a robot, I suppose. I don't know. But then they took that out after a while. He lived 900 something days with that, which was more than anybody else in a long time. And then they gave him a heart transplant, and he lived for 12 years after that. So, and he was, even all of that mess, he was still exercising, eating right, doing the right thing, and he was feeling good up until the day that he was gone. And that's my goal. And I had a preacher friend of mine told me, he said, look, you don't have to have a disease to die. When God's ready for you to come home, you can just walk in full health right on into heaven, and you don't have to have some kind of crazy disease that's going to defeat you. You don't have to have that. So here's the deal. We can, whatever disease it is that's messing with us, we can live a long, productive, happy, healthy life. I heard a guy on the radio the other day was talking about getting some life insurance, and he said, you need to get life insurance because when my father-in-law died, or when my dad died, he was in his 60s or somewhere, and he died, but he left life insurance to the family, took care of the family, but he lived up to 60 some odd years old in good health, and you're looking, hey, the guy died, how could he be in good health? But you can be. You can be in great health, and no matter what disease you have, these simple things, exercise, sleeping right, eating right, is going to help us feel better and going to help us live a more productive and happy life. Right? So we need to be doing some stuff. But it's important to stick to treatment and take good care of yourself. So we need to be doing that. See, now, are HIV and AIDS, we got AIDS here, we got HIV, are they the same thing? Why are you not? You said no, how come?
Yeah, HIV eventually turns into AIDS.
Said it. Yeah, sure. AIDS is the end product of HIV. Once we get to the place of AIDS, we're in probably the spiral that's going to wind up taking our life. Now, people can live for a little while with AIDS, but we have all sorts of things, like we were talking about opportunistic diseases and stuff like that. And we have like the disease of wasting. The wasting disease means you just kind of shrivel up and go away. So it's some pretty bad things. But no, they're different things. HIV and AIDS are not the same thing. But when somebody says, I have HIV, what's the first thing that runs through your mind? AIDS. I have HIV. Okay, That means AIDS to me. Also, I have HIV, means I might catch it. So would you be nervous if somebody in the group says, hey, I have HIV? Yeah, yeah. Would you be nervous if somebody that came to work for you or work with you and they came up and said, hey, by the way, I have HIV? Would that make you nervous?
Yes.
Well, and that's normal. Do you have, do you get nervous when somebody tells you, hey, I have cancer?
No.
No, that doesn't. No. And what about, hey, I have an addiction problem? That doesn't make us nervous? Why not? What's the difference?
Only because it's not contractable. One, it's our own treatment. It's our own disease. It's a one-on-one.
And we believe that HIV is more contractable, as you said, than these other things. Is it contractable?
Sorry.
Can you contract it? Can you get it? Is
Is
it contagious?
Yeah, if they party with you too much, yeah.
It can be contagious. Absolutely. But here's the deal: it's not as contagious as we think it is.
Right.
So this is one of the things people are scared to death. I hired a young lady to be a supervisor for me years ago, and I hired her, and then she came in and she was sitting in my office one day, and she said, "By the way, I'm HIV positive. I just want you to know." So, okay, thank you. Can't discriminate against somebody that has cancer. You can't discriminate against somebody that has addiction. You can't discriminate against somebody that has diabetes. You can't, because people have. They say you have diabetes. Like Monday, I have a doctor's appointment. And I've got to go. I've got 17 different things that I have to do here, but I've also got to do that. So I've got to work that in. Yeah. And so, they're not the same thing. HIV is a virus that weakens the immune system. We know that it makes us more susceptible to all viruses that are out there. If anybody's going to catch a cold, guess who's going to catch it? Person with HIV. If anybody's going to catch COVID, if anybody's going to die from COVID, anybody here had COVID? I had COVID. Was it bad for you?
Yes, sir. I thought I was going to die.
Yeah. I had COVID. It was like maybe a mild cold. Nothing. Nothing. When I went to the doctor, I thought maybe I had a cold. I wanted a shot in my butt, steroids. And she said, "Oh man, you got the COVID." I said, "Okay, thank you." She said, "Well, you got to go home and do, okay." So I did. I went home, sat around a while, and watched TV and had a good time. And COVID was over with in about 7 days. It was done. No problem. My wife had it too. Same thing. No problem. My neighbor across the street from me died from it. The only difference that I know is that I exercise, I eat right, I sleep enough. The lady across the street, morbidly obese. Didn't ever exercise, didn't eat right, didn't sleep, slept on the front porch, stuff like that, and it killed her. So it's a virus, and it attacks your immune system. It can cause inflammation and damage inside the body itself, making it harder for your immune system to fight off other diseases. Now, there's a whole bunch of things that we can talk about why that happens. If left untreated, HIV eventually leads to AIDS. And when it gets to AIDS, then you have a real issue. Also known, it's acquired immunodeficiency syndrome. That means your immune system is messed up, right? And it means that you acquired it somewhere. It didn't just happen to you. So here's the deal. Living with HIV does not mean it has to progress to AIDS.
Sorry, sir.
Living with HIV does not mean it has to progress to AIDS. If I have HIV, that doesn't necessarily follow that I'm going to die from AIDS. It doesn't necessarily follow that I have to progress to the disease of AIDS. Sticking with treatment or sticking to my treatment can help us live a long and healthier life, and I can die after 30, 40, 50 years of living with the HIV virus without it ever going to AIDS. But if I don't get it treated, and if I don't do it right, and if I don't take care of myself, it's going to go there. It's going to progress to that. It's going to become that, and it's going to be that if I don't do what I know I need to do. And look, even if we don't have that dread disease or any other dread disease, taking care of ourselves with exercise, sleep, the right food, and all of this kind of stuff makes sense anyway. Even if you're perfectly healthy, there's nothing wrong with you. The act of exercising, eating right, and sleeping well is going to help you in the long run. You're going to feel better, and you're a lot less likely to catch any of the diseases that we're trying to avoid, right? We don't want any of those diseases, do we, Mr. Wright? No, we don't. We don't. We don't want to do that. But once we've got them, we need to continue to take care of ourselves. And as we take care of ourselves, we're going to feel better. We're going to be able to live with the disease, and we're going to be able to have a long and healthy and prosperous life. I have the same disease you have, and also added on top of that, I have diabetes. Okay. But I'm 70. I just turned 72. And now I'm getting all of these ads. People are sending me stuff about what happens to your body after you hit 70. Oh no, I'm in better shape now than I was in my 40s. So I'm not too worried about that. So who can HIV affect?
Everyone.
Everybody? Yeah. Okay. HIV can happen to anybody, happen to anyone. Remember when it first came out? Some of y'all old enough to remember when back in the 80s, HIV suddenly came upon the scene. What was it called? The gay man's disease.
Oh.
Yeah. It said that's only happening because of M to M sex. Man-to-man sex. That's the only reason it's happening. Is that true? No, that was the biggest thing that we saw happening. That's the thing that we focused on and said, okay, all right. What we have to do is stamp out homosexuality and gays and all of that stuff, and the disease will go away. That proved to be a faulty premise. That's not true. So it says, look, it can affect anybody regardless of age, regardless of race, regardless of sex, regardless of gender, sexual orientation. Does HIV affect gay people?
Yes.
Yeah. Does HIV affect heterosexual people?
Yes.
Yeah. About at the same rate. So, just saying this is a disease no, it's not. It's a disease for anybody. Can all get that. HIV doesn't change who we are and doesn't care who you are. It is a virus. So it doesn't come along and say, okay, you're such and such and you were this and you were that, so I'm going to infect you. It comes along and says, here's the big deal. Usually it comes along and says, okay, you have engaged in this behavior, so I'm going to affect you. So how is HIV? Let's forget. But how is HIV transmitted?
Oh, wow.
Through the blood.
Through the blood? Yeah. Okay. HIV is transmitted through blood, right? It's also transmitted. It can be transmitted through sexual contact where there's some tearing or something. That's why they had the M to M thing going on back in the day. It can be transmitted how else? By needles. So I've been in classes where they teach you how to clean your needle. Is that a good idea?
No.
No, no. You can't clean it well enough for that not to happen. So the big deal is don't do that.
Throw it away.
Say it again?
Throw it away. Get rid of it.
Yeah. And what we found out is even after you clean it, people were cleaning the needles with bleach and all of that kind of stuff, and there was still some HIV virus in the needle hub. So it was down in the needle hub, down in the bottom of the needle down there. So when you sucked up whatever you were doing there, it sucked that stuff up with it and it got into your bloodstream. And then, of course, you can get it from mosquitoes when a mosquito comes by and takes blood out of a infected person and then comes and gets you, and it can give you AIDS. Is that true? No, that's not true. Why is that not true? Makes sense, doesn't it?
Well, it only died after they fill up with blood. I think the mosquitoes pass after they fill up.
They fill up with blood and then they die?
That's what I'm not strong.
I'm no good when it went there.
Say it again?
When it's airborne.
Yeah. Yeah, well, yeah. And if it's, if you're talking about airborne, a mosquito flying it is not the disease
but
being
it's still
airborne,
the
it's
blood
still
in
inside
their
the
mouth,
mosquito.
right?
So,
Well, I guess maybe it's not enough.
well, there's several different things. Of course, you can't get it from a mosquito. There's several things. First off, mosquitoes never break your skin. Did you know that? When you get bitten by a mosquito, they never break your skin. If you look at the little thing on a mosquito, catch a mosquito and put him under a microscope, look at the little thing that he gets the blood, the siphoned hose that he has, it's not hard enough to break your skin. So what they do is get to where your hair is, and they put that thing down through there, and it goes down past where the hair is, and it goes in that hole that's already there, and relieve blood from there. But they also have a little check valve that closes it off, so when they take blood from the next person, they're not releasing blood into that person, they're taking stuff out of that person, not putting anything into that person. And also, they have a certain enzyme in their body that seems to kill the virus. And we're studying that thing, man. They're studying that, and they figured out, hey, that works really good for a mosquito, but it doesn't work for people. So it's just like, this disease came from monkeys in sub-Saharan Africa. And with the monkeys, it's not HIV, it's SIV. What does that stand for? Simian immunodeficiency virus. So when the simians, the monkeys, when they get HIV, doesn't hurt them. It's like getting a cold to the monkeys. So it doesn't hurt them at all. So when it gets into our bloodstream, it mutates and becomes something that will murderize us completely. So it's just different. So in the body of a mosquito, this enzyme does something to destroy that virus. But in the body of a human, it won't work. So, they're trying to figure out, well, it'd be a really good thing if we could do that. That'd be great. But we haven't been able to figure that out. So it's transmitted. It cannot be transmitted. This is one of the things we need to understand. This just seems to be the natural place for people to get off, doesn't it? It does. It does. But some people do that. They read the sign. They say, hey. So that tells us they have good vision. Yes, sir. Well, yeah, you're right. So how is it transmitted? HIV cannot be transmitted, look, through touch, tears, sweat, or air. It's not going to be transmitted that way. It can be transmitted through blood, any way you get the blood. If the blood is, if you get it through a transfusion, y'all remember Arthur Ashe?
Yes.
Arthur Ashe was a tennis player, and he got HIV, and he got it from a transfusion. But that was way back in the 80s, okay? You can't get it through a transfusion here in the United States. You go to Mexico, you can get it. They don't do their blood the same way we do our blood. So here, you're not going to be able to do it. So it can be done by through blood, semen. If you're having sex, and you can certainly contract it that way. Rectal fluid, vaginal fluid, breast milk. Research shows that while taking treatment as prescribed and getting to and staying undetectable is one way of preventing transmitting HIV through sex. So if we can get ourselves to where if I have HIV, but I have the viral load that I have in my body is low enough, if I can fight it low enough, if I can take the treatment well enough, and I get that viral load down to a certain level, then I'm not going to be able to transmit it through sex. That's a really good thing that we came up with that. So, but there are other preventable methods available. Undetectable means that there is so little virus in the blood that a lab test can't measure it. And we've got those two things that we're supposed to be using. And so, if it can't detect it, can't measure it, it's not going to be able to tell us that it's got it. And so we're not going to be able to pass it on, right? But we need to talk to our healthcare provider. If we have an idea that we might have gotten a place where we were, maybe there's a chance, we don't need to just think about that. The CDC says that every person in the world between the ages of 15 and 65 should be tested at least one time in their life. That makes sense?
Absolutely.
It makes sense. I'm sure that's not going to happen. That's not going to happen.
Why put it up at 65?
I don't know. I guess they figure that once you get 65, you ain't gonna catch it. But I don't know. And I don't. I know so many children below the age of 15. That's nowadays that's pretty old for a person to begin their sexual adventures. Usually there's 8, 9-year-old people that are involved in sexual activity. So I'm thinking it should go a little bit below that. So do HIV treatments work?
Yes, now.
Yeah.
Yes.
Man, they fought that. They went a whole long way. They've done all sorts of research. And yes, it does work. Today, when they're taken as prescribed, HIV treatments can help people living with HIV to live longer and healthier lives. And they can live a normal lifespan. What's a normal lifespan?
70
years. Somebody lives 70 years. That's a pretty normal lifespan. The Bible says I can live to be 120. So I'm shooting for 100. I don't know if I want to be 120. But you have to take it as prescribed. HIV treatment can help people living with HIV live longer and healthier lives as long as we take it as prescribed and do the other thing. Exercise, eat right, sleep. So the risk of, by lowering the amount of HIV in the body to an undetectable level, what we do, lower it to an undetectable level. We were talking about the lady that was married and her husband was not infected and her children were not infected. So her viral load was at a place where they could safely have sex and do all of those kinds of things where they would not have those problems. It says, which means there's little to no virus which means that there is so little virus in the blood that they can't do it. They can't find it. HIV treatments today also help raise the number of immune systems in the body, so immune cells in the body, so that people living with HIV can stay strong and healthy. So those those cells that we have T cells in there that are combat cells that fight the virus. And some of these treatments that we have nowadays add more of them to our body. And so we need to have more of them in our body. And so now we have more that's fighting it. So it is not a death sentence. So how does it impact pregnancy? Well, we're going to find that out when we get back from our 15-minute break. Y'all get back about 15 minutes after, and we'll get started again.
I believe that you do. There's your deal, man. I ain't gonna do you don't throw anytime I tell you something. Yeah, come on, baby, deal with I tell you. Alright. So if we're gonna everybody. Now, only if you walking. Not walking is what's bad. Where they can They can't do shit like the cracker that doesn't say about what you got going on. Man, fuck you. And I just say one for the face. Man, fuck you. That shit don't get me tired. I'm not fucking with you. I'm not fucking with you, bro. Yeah, bullshit. Man, shit been going on since we been here. They walk right there. Now all of a sudden they want to come to this bullshit. Man, fuck you. Really? Well, you might get it. Like, they don't, and they tell them, well, don't give a fuck about you. They like you sitting there talking, and we talking about what you talking about. And you already working. Yeah, do what the fuck you think you ain't going to I'm talking about the same thing, man. What you talking about, man? You like you know what the fuck going on with this shit. Yeah, fuck you. Really. Amen. So you said you already been checked in, dummy. Why you had to get him all worked up? What you say, Josh? Hey, it wasn't me. What you say? What? Shit. I know they do. I know that. I wake up in the morning going, okay, let me see. Let me just find something. I told y'all, and I'll tell you, I want to see. They'll never tell the secret. It's always me. Always.
Yes, sir.
Look, look, look. What the hell? What? You know what? Hey, listen, go. Go. Wow, man. I was in trouble. But I agree.
All right. Let's call it being back. Remember, we're going to quit a little bit early, so we may have to go through some of this kind of quickly, but I want to get it all done if we can.
10:30 is fine with us.
Yeah, okay. So how does HIV impact pregnancy? Used to be really, really nasty because a lot of the times, you know, the kids, when they got through, when they were having a child, and the child would contract HIV because it's going through the birth canal and there's tearing and there's all sorts of stuff like that. Nowadays, it's a little bit different. There are things we need to consider to help protect ourselves and baby during pregnancy. The risk of transmitting HIV to a baby nowadays is about 1% or less. So it's almost certain that they're not going to get it. It does happen, but almost certain they're not going to get it. If you take the HIV treatment as prescribed throughout pregnancy and deliver and give HIV medications to your baby for 2 to 6 weeks after birth, what happens? We have the medication that does fight the HIV virus in the baby, and so when the baby is born, we immediately began to give the child the medications to fight the HIV virus. That helps. Remember, we were talking about there's some medications now that help to boost those fighter cells, those combat cells in there, these T cells that fight the stuff. So this kind of really gets big in those children as they're born. So also, of course, we usually when the babies, it's time for the baby to be born, then they are done by cesarean section, right? Which makes it less likely that they're going to tear down through the birth canal and stuff like that. The goal of treating HIV while pregnant is getting to and keeping that viral load at an undetectable level. Remember we said if we get the viral load at an undetectable level that you can't transmit it by sexual contact, right? Because it's just not there. It's not detectable. So we cannot cure it, but we can get it down to an undetectable level, which is, just as good as when you're doing something like as intimate as having sex or having a baby. Oh, that's you. Okay. I know the sound. I know the sound. Um, So the goal of treating it with pregnant is getting that viral load down where it's undetectable. To stay healthy, prevent transmission to the baby. Undetectable means that there is so little virus in the blood that a lab test cannot measure it. So it's just like it's not there. It is crucial when you get pregnant to work closely with your healthcare provider to ensure the best possible outcome for both the mom and the baby. So here's the deal. This is why I told you I had the lady who was my client, 23 years old, had 3 children, right? And she was HIV positive. None of the kids were because she was keeping her viral load down to 0 anyway. And when she got pregnant, she and her doctor or team of doctors worked to make sure that that viral load stayed where it needed to stay. And then she had all 3 of her children by cesarean section. And then immediately after they were born, they were given those drugs so that the child did not have an issue with HIV. That's an amazing thing, isn't it? That's where medical science has taken this disease. It came from this, you're going to die, or your life is completely destroyed, everything is gone till, okay, I got this thing I got to deal with. Right? Same thing with the diabetes. Okay, at one time it was you're going to die. Here you go. You can't eat anything. You're going to die. To now, hey, we have this thing we have to deal with. Same thing with all of these diseases that are going on. That doesn't mean it's not going to get us. It can get us. However, we can live a long and productive life with it if we do the things we're supposed to do. Take our drugs the way that we're supposed to take our drugs. Exercise well, do what we're supposed to do, eat the right foods at the right times. How many times a day are you supposed to eat?
3.
3 times a day?
3 to 4.
3 to 4?
1 or 2.
One or two? No, these are not how many times you're supposed to eat. These are how many times you eat. It's best to eat 6 to 8 times a day. That we were meant to do that. God made us to be grazers and hunters, and we're supposed to eat that way. If you go look at a bodybuilder's diet plan, they eat the 3 meals a day, but they also eat a meal between the 3 meals and have a snack. They're rolling their protein and their carbohydrates throughout the day. So, you're supposed to have breakfast, lunch, an evening meal, and your breakfast is supposed to be the biggest meal you eat that day. Have a big breakfast, and not the junk that we eat here, but, eggs and bacon and, good ham, whatever, a good meal. And then for the midday meal, you're supposed to eat a little bit less, maybe with some salad in there and stuff. And then the evening meal is supposed to be a very light meal. Maybe just a little something, a salad or something. We do that backwards. We eat a small breakfast, a medium lunch, and a huge supper meal. And, okay, let's have a baked chicken and a baked potato and 14 pieces of, that's why we are usually, most of us, a little bit out of shape. So that's what's going to happen with our baby, but we need to keep that baby, we need to do everything we're supposed to do, and the babies can be healthy and never contract the disease. So, are all the treatments the same? No. Are all HIV and AIDS treatments the same? And he said no, and no, that's true. They're not the same. That's why you have to get with your provider and let them know what's going on with you, let them know your life events that are about to happen. Let them know, hey, I'm pregnant. Let them know, hey, I'm about to go on vacation. I'm about to do this. I'm about to change jobs. Because believe it or not, all of those things cause stress in your life, and stress can impact your treatment. Right? With any disease you have, stress can impact your treatment. Not all HIV treatments are the same.
I was going to ask you, you saying when they load the T cells down real low, looking under a microscope, are all the T cells and microorganisms and all of that still detectable to see under the microscope, but the cells are low?
Yeah, they get to a place where they're undetectable.
Okay.
And there's a couple of, we're going to talk about that in a little bit, but there's a couple of tests that you can take to see if you have them. And the way that we know that we have them is your body starts to fight. And when you get the HIV virus in there, your body starts to send T cells to that virus and fights that virus. It takes about 3 months for your body to build enough of those T cells that are fighting that virus for it to be detectable. But when they detect it, then they can say that. So we start using the drugs and stuff that fight that enough to get them down below the level where they're detectable. And at that place, we're undetectable. Our viral load is undetectable. That means my treatment is working the way that it's supposed to work. I'm keeping myself in good enough health that that virus cannot attack me and do the damage that it wants to do. So, not all treatments are the same. So we can't take somebody else's medication or anything like that. There's many different types of treatment options when it comes to HIV. Most of the time, we've got to work with a person to figure out what that is. If you're diabetic or something that you go to your doctor, they're going to give you a certain amount of drugs, and then they're going to watch you over about a 3-month period, and then they're going to see how that drug works. If that drug worked great, they're going to leave you on that drug, right? Because it worked great. But if the drug did not work great, they're going to modify it. They're going to change some things and give you a new drug, or take this one off and that one. I went to my doctor and she put me on something. Can't remember what it was, but it just made me feel terrible. It was working with the diabetes thing. It was keeping that where it's supposed to be, but I felt like, okay, if this is the way I'm going to be, I don't like this. So now on my chart down there, it says, can I take this? Makes you feel better. And so, and we do the same thing with HIV. Whatever drug we're giving you, if it works great, great. If it doesn't work great, we have to modify.
All of the treatment intravenously or pills?
No, most of them are pills. There are intravenous treatments, but there's a lot that you just take by mouth. So not all of them are the same. There's a whole lot of different options. Treatments may be made up of different medicines. They have different instructions on how to take them, different kinds of side effects. That's one of the big things. Some of these things, when we first started treating with these drugs, have horrible side effects. Now they've gotten to the place where the side effects are manageable. It doesn't mean that they don't have side effects. That means they're manageable. That's what was going on with that drug that I was taking. It had that side effect. There's another one that I took for a long time that would give you a urinary tract infection. I don't know if you've ever had a urinary tract infection. I'm going to tell you, it's not something that men or women are really happy about when you go to the doctor, oh my God, this ain't good. And so there was one that I was taking, and the reason that it did that was because its main function was to cause you to urinate more sugar out. And as the sugar came out, it caused, in some people, not everybody, it's a good drug for some people, but for me, it caused this horrific urinary tract infection in about a week. And, and you go, okay, all right, so it's on my thing down there too. It says, can't take this because it's urinary tract infection. If you suggest it, Dr. Garner will slap you. So we don't do that. So not all of them are the same. That's why you've got to go to your doctor. You can't say, if this guy here is taking a baby aspirin every morning, and so it's good for me too. No, you got to go and talk to your doctor about whether or not you ought to be taking an 81 milligram aspirin or not. What does an 81 milligram aspirin do?
Low dose.
The low dose aspirin, what does it do?
Change your blood.
It thins your blood just a little bit. I take one every day. I have 3 stents in one of the vessels going to my heart, and so I need one. You know, there are other people whose blood is already a bit thin. You don't need one. You don't want to do that, because if you pick your nose and it bleeds, you gush yourself to death. You know, so you don't want to do that. So we need to have whatever we need to have, and your doctor is going to know exactly where that is going here, and then what's the different vein that you need to be in. So treatments are not the same. So you can't just, hey, my wife has HIV and now I've got it, and I'm going to just take the medicine that the doctor sends her home. That's not going to work. Can't do that. Can HIV be cured?
No.
No, we don't have one yet. We're working real hard at getting something. They're still working on getting a cure for that. Did you know that they're also working real hard at getting a cure for addiction? We're working really, really hard trying to find a cure. This is this pill. If you take this pill on a daily basis, you will no longer be addicted. We're working on that. They've been working on that for years and years and years and years. They say now that since we have AI working on all of these problems, that within 5 to 10 years, we will have a cure for cancer. I don't know if I believe that or not, but okay. Okay. Yeah. Okay. If they can cure cancer, then they can cure diabetes. They can cure addiction. They can cure. Okay. All that I'm for. All of that. So it can't be cured. HIV treatments can't not cure HIV. Won't do it. But they are going to help people live longer and healthier lives and reduce the risk of HIV being transmitted to sexual partners. So, when taken as prescribed, HIV treatments can help lower the amount of HIV in the body to an undetectable level, which is what we want to happen. We want to get it down to where we just can't find it anymore. Which means there is so little virus in the blood that a lab test can't detect it. If a lab test can't detect it, you can't spread it. And you can get that to that level, but we don't need to get to the place where we take a few of these pills and think, okay, I'm done. We need to take the medication, do all of the other things that we're supposed to be doing, then go to our doctor and get an ELISA test. What is an ELISA test?
A blood count.
It is a blood test, and it is the first test that you get to take. You take the ELISA test, and the ELISA test can tell you, yes, you have the virus in your body. It takes, as we said already, about 3 months for your body to build up antibodies to the virus. And once your body has built up antivirus to the virus, then it can be detected. Those T cells can be detected at that point in time. So we know there is this possibility that you got it, but it takes about 3 months. And so if you've done something that's questionable, or you've been with someone who's questionable, or you've used some drugs in a questionable way, you need to wait about 3 months. And so what should you do during that 3-month waiting period?
Don't engage in the same.
Don't engage. Get celibate for 3 months. Don't do that for 3 months. Wait, because if you've got it and it hasn't shown up yet, it can still be transmitted. So hang on. Just hold it a little while. Yes.
So I had sex Monday.
Yeah.
Say wait weeks before I get tested.
3 months.
3 months before I get tested.
Yeah, wait 3 months before you get tested. Look, you can do an early test. There are a few other tests that we're going to be talking about. So you can do an early test, which there is a quick test.
I want to do this.
Okay, there's a quick test, and we can do that, and that will give you an idea. Doesn't give you an absolute, but it gives you an idea.
That's what I was going to ask. Will it protect it?
Right? No, it's not an absolute, but it'll give you an
3
idea.
months. 4 months.
So about 3 months, that one is also a good. That one's a good idea. That one's not an absolute. That's a good idea. That is the ELISA test. If that one says you're positive, what does that mean? You have some of the antibodies in your blood and you may be positive. That thing sometimes gives a negative, gives a false reading. So sometimes it'll say you're positive when you're not positive, and sometimes it'll say you're negative when you're not negative. So what's the point? It does tell you that, hey, you have the antibodies in your body. So, okay, got those antibodies, so there's a good chance I might have it. There's a second test. If that one pops hot and you say, okay, yeah, you got it, then you wait about a week, wait maybe 2 weeks, and you go have the second test. Second test is called an ELISA test. No, it's not. The first test is called an ELISA test. The second test is called the Texas blot. The Texas blot test is a pretty absolute. If the Texas blot says you got it, you need to go forward believing you have it.
So to get an accurate reading, you wait 3 months.
Yeah, I would look. If it were me, I'm going to do the quick test, and I'm going to go do the ELISA test, and then I'm going to do Texas blot test. And one of them will tell you. I got tested years ago. Stuck my hand up in a thing. I was working as a compressor mechanic, stuck my hand up in this little area where we were trying to get something loose, and there was another guy right there with me. He stuck his hand up in there at the same time. We both got cut. What does that mean? Blood transferred between the two of us. I put my hand out.
How can I get on board?
Well, I did. Well, we can work on that, but I didn't. We had one blood test. They were doing a blood drive that day, and they said, well, we're not going to take either one of y'all's blood because we just don't know. So they did a blood test on us. Both of us came back negative, but I didn't go forward from there. So but I feel like that I'm all right with that. So I'm going to talk about it. It can't be cured. It means that there's so little virus in the blood. Current research shows that taking HIV treatment as prescribed and getting to and staying undetectable prevents transmitting HIV through sex. That is a big deal. If we can get them down where we can't detect them, we'll get that viral load down where we can't detect them at all. Now, if you do it and they say, hey, look, you've got a viral load of 100, should you have sex? No, because you can still do it. But if you have a viral load that they say, okay, we can't detect it, then you cannot transmit it if they can't detect it. Myself personally, if you take the test and they say, okay, you have a viral load of 2, you may be able to, but I ain't going to do it. Yeah, you still have a viral load of 2, and when somebody walks into this room and sneezes, and you know what? I'm not going to be kissing on that person. I'm not going to be loving on that person. I'm not going to be around that person and all of that stuff because I don't want to catch that cold. But I'm also believing that if they walk through this place and just sneeze and I never get around them again, there is also that chance that I might. So if my viral load is at 2, there's this chance that I might spread. And look, if I've got this as a dread disease, and if I have this disease, I don't want to spread it to somebody else. Right. Luckily, diabetes is not catching. I can't give it to somebody. If I did, I wouldn't be around people. I'm not going to give you something like that. If I can help it, I'm going to do my due diligence to make sure you don't get what I got. So when I see you guys eating Pop-Tarts, that's why that time we did the study on what was on the back of a Pop-Tart carton, and the ice cream, what do they call them?
What, those?
Not the ice cream sandwich, but the other thing. They've got so much stuff in that, and if you take an ice cream sandwich and lay it outside, nothing will eat it. Bugs won't eat it, squirrels won't eat it, birds won't eat it, nothing will eat it. But me and you, we'll eat it. We'll eat 9 of them. But the bugs are smarter than we are. They'll get up there and take a lick. They won't eat that stuff. Ants won't eat that. So anyway, or HIV treatment and PrEP, the same thing. Most of us don't know what PrEP is. What's PrEP?
Oh,
PrEP is something that we can take before. This is a preventative. No, HIV treatment and PrEP are not the same thing. PrEP or pre-exposure prophylaxis. Pre-exposure prophylaxis is a medicine. It sounds like it is a condom or something, but it's not. It's a medicine that people can take before they're exposed to HIV. If you knew, okay, I'm about to go over here and I'm going to have sex with that person and they have HIV. First thing first, what do? Don't. Don't's a good plan. Don't. Run like crazy in the other direction. If you cannot help yourself, you need to take this medicine. It's a medicine you can take before you're exposed to HIV to help reduce the chances of getting it. I want to reduce the chances of me getting it. That's
got a question. Is it against the law to know you have HIV and have sex with someone and not tell you?
Yeah. Yeah, it is. You should look. That's a deadly disease that you're giving to someone else, and there have been people in the past who have weaponized that disease.
Well,
They've used it. They've gone. Say it again. I'm not really sure what the charge is, but you can be charged with something. So if you know you have that, what's the first thing you need to do?
Absolutely, let people know if you're going to be engaging in sex with them or whatever. You have to do that.
Now let them know. You know, it's just like the lady that I hired that came. She said, "I want you to know that I have HIV." The first meeting we had with the staff, she's their boss. I'm her boss. She told me, I'm like, by law, I can't tell them.
No.
Why can I tell them? But, so we're sitting in a staff meeting. She had, I don't know what her staff had, 4 or 5 people that were her staff. And in that first clinical meeting that we had together, she said, "Guys, I want to tell you, I'll let y'all know that I'm HIV positive. I just want y'all to know that." She was way open about it. She was living a positive, healthy lifestyle. She was, she was an LCDC. She was a leader in her field. She did some great stuff, but at the same time, she was very open about what had happened to her. She had contracted this disease. Yeah, and that's a safety thing, and if somebody does, by some strange way, contract it, they got to know that she was open and above board with that.
Right.
And they're not going to contract it. You can't, if you accidentally go in and pick up somebody's coffee cup, you drink the coffee, you're not going to get HIV from that. You're not going to get HIV from pecking somebody on the cheek, hugging somebody. You're not going to get that. I will tell you that it took a minute for that staff to get comfortable with that. Some of them were freaked out, and they had to be made comfortable, and they had to have a training. And it's not like we trained. We didn't just, it's just like this. We didn't do that training because she was there.
Right.
We did that training because we have to, everybody here is going to get a certificate for having been in this training. Because we have to teach HIV awareness in this training. And then that certificate, you can get a copy of it, but then a copy of that will be uploaded into your file so that the state knows you got training.
Right.
So you know about all that stuff. So we did the training, but there's a couple of those people who were really a little disconcerted about that, and they really didn't have a reason to be. And after a while, they, and just came to love her and understand that that's just another disease.
So do we have to, like, if we want a copy of that certificate, we can ask you all for that? Or y'all
I don't know how, I'm just Miss, your counselors are going to do that. I don't know that Miss Charnel's going to do it for everybody, because all of you are not the counselor, client, but they're going to come up with some. They may be different. The counselors may make them different. I don't know. But if you want one, ask for one, or I may just, y'all need one.
Hey, I'm supposed to go to the doctor at 2 o'clock. So,
Yeah.
So I'm get the test.
I don't know that there are different doctors do it differently. When I
Counsel said to get tested. She called to the doctor and said get tested from the throat and all that.
if you want that test, tell them when you get there, or you can have your counselor let them know. Yeah. And some of them will, some of them are not set up to do that. My little PCP, she got a rock and a stick. I love her to pieces, but she got her medical degree in some island somewhere.
So just tell them when I get there today.
Yeah, let them know that you're interested in getting that and see what they have to say. So this is stuff you can take, and it's effective. It can be highly effective at preventing HIV. HIV treatment is medicine that is prescribed after someone is diagnosed. When taken as prescribed, the treatment can help reduce the amount of HIV in the body to an undetectable level, which means that there's so little virus in the body we can't measure it. And when we get it to the place where we can't measure it, we can't spread it. And that's a good thing. And I don't think I want to look at that. So the importance, how important is it, do you think, to get tested?
Very, very, very.
And a lot of it, look back down through the years and see what your behavior is. I have some behavior in my life that warrants me maybe getting tested, right? So that's why back in the day I got tested. And so if you have some behavior in your life that warrants you getting tested, then get tested. It's for your own peace of mind to start with. I need to know. Yeah.
Sometimes our partners have the choice, and we don't know. They don't know. So it's absolutely we need to test it anyway.
Absolutely. And sometimes, look, if you're sexually active, if you have a history of drug use, if you have a history of intravenous drug use, all of that kind of stuff, you need to know. And your partner needs to know. And here's the thing. I've been married for 52 years. I love my wife. Is there the possibility that she may go outside the marriage and do something weird?
I want to think of that.
I wouldn't think that but there's that possibility. There is. So sometimes I may need to get tested, not because of my behavior, but because of my partner's behavior, my spouse's behavior, right? Because things happen. We had a guy that came and wanted some. He had some type of STD, and once he got the medicine for the STD, and then he wanted to get another prescription for the STD, the medication, whatever, oxycillin, I think. We said, okay, all right, that's weird. Why do you want two prescriptions? And he said, well, because, my wife. And so, and he said, what I'm going to do is tell her that you guys said I had a real bad yeast infection, urinary tract infection, and since I have this real bad urinary tract infection, you probably have one too. So I'm going to give. I don't know what they did. I'm not a medical doctor, so I don't know what they did. But that sounds a little reprehensible, doesn't it?
Yes, it
I'm gonna lie and tell her, y'all. I don't know if I wouldn't have given it. She needs to come in.
Maybe. Can urinary tract infection?
Well, it is that. Syphilis is probably a urinary tract infection.
Right.
So anyway, I don't want to do that. So here, it's important. Some HIV tests use blood drawn from your vein. Other tests might use oral swab, urine, or blood from a finger stick. If you have HIV, finding out quickly means you can start treatment right away so you can feel better and live a long, full life. You can also take steps at that point so that you don't spread it, pass it to other people. If you're pregnant, ladies, You can get tested because early treatment means you probably won't pass it to the baby. Less than 1%. This study said 1% or less. Every study I've ever seen said it's less than a 1% chance if you do the right thing. So testing is recommended during your first trimester. If you're considered high risk for HIV, you'll want to have HIV testing several times during your pregnancy. Look, let me just say this. This is just for me. If you're pregnant, cut that crap out. Stop doing some stuff we're doing. Stop taking drugs. Stop drinking alcohol. Stop smoking cigarettes. You're impregnated, right? You're not, not thinking about your fun that you're missing, thinking about the life that you are about to bring into the world. You want to do all that. Say it again?
Get those prenatal vitamins.
Get the vitamins, what you're supposed to do. Who should get an HIV test? The CDC, remember I told you all this already, recommends that everyone in the United States between the ages of 15 and 65 get tested for HIV at least once. Mm-hmm. So if you're between the ages of 15 and 65, then you need to get it. But here's the thing. I think that's a number somebody pulled out of the wall somewhere, out of the air somewhere, because I'm going to push that back to probably 10. Yeah, 10 years old. If you go to the doctor, get that test. And I'm going to push it up to about 80. I guess they're thinking that once you live to 65, you don't have to worry about it. You ain't worth, I keep getting these things I told y'all, I hit 72 and they keep sending me stuff,
So when you have the test and you're 25 years old, what about the other year? You're still living longer. So one test is you think later more than
now,
that.
I'm going to tell you this, and what they're talking about is people who are not really at risk. If you feel like you're at risk, you need to get the test more often. If you have 12 sexual partners, you need to get the test more often. If you're an intravenous drug user, you need to get the test more often. You know your own behavior better than anybody.
I took the test 4 months ago. I've had sex with 2 different. Well, this is female.
Yeah.
So I don't want to take this again.
Yes, and I think that you should. I think you should. If for no other reason than for peace of mind. You need to have peace of mind. So if you've had, you should be tested more often, at least once a year. If you're at high risk of getting HIV, if you've had several sexual partners since your last HIV test, if you've had unprotected sex with someone who is or might be HIV positive, you don't know, someone whose sexual history you don't know. If you're having sex with somebody that you just met this morning or this afternoon or 30 minutes ago, you don't know. Because here's a fact. If someone will have sex with you, they will have sex with anyone. Somebody meets you and 30 minutes later they're going to have sex with you, that means they'll have sex with anybody 30 minutes after they meet. So you don't know. Injected drugs using a needle have been getting tested for tuberculosis, hepatitis, or any sexually transmitted disease, including syphilis, gonorrhea, chlamydia, or herpes, because when you get HIV, it makes it 10 times easier for you to get these other sexually transmitted diseases. Remember, your system is not working properly. And it would fight all this stuff. It's not going to fight. You have exchanged sex for drugs or money. Had sex with someone who has a history of any of those things, or have been sexually assaulted. Because you don't know what that person has. There's 2 basic ways to get HIV test results. We have laboratory tests now. You should not have them. For those tests, a technician takes a sample of your blood, tests it. You can get the results within a few days. There's a thing called rapid test. And I don't have any of them. They may have them at your doctor's office. These tests provide results in about 20 to 30 minutes. You can get them done in a community clinic, or you can even pick them up from the pharmacy and take the test at home. So those are, look, their reliability, of course, is just like anything else. I have several of the COVID tests that I take at home. Those, every one that I've taken have been negative, but those, their reliability is fair, but they're not absolute. And just like the HIV test that you get that you can take at home, they're fair, but they're not absolute. They're called a rapid test. When to test? You know when to test. If you're at high risk, you know if you're high risk, so test. Every HIV has a different window period. That's how long you need to wait after exposure until you can expect an accurate result. No HIV test can tell if you have the virus just after you've been exposed. Your body has to build the antibodies. If you get tested too soon, you're going to get a faulty result. But if you wait too long to learn, then you can miss out on early treatment. So, the standard HIV test can find antibodies in your immune system. And this is different because it's a different test. The one that I said, wait for 3 months. That's the ELISA test. This test that they're doing now is within 23 days and 3 months. So somewhere within that 3-month period. Yes.
Possible symptoms
of
HIV or AIDS.
It feels just like a real bad cold when you first have it. You'll have the sniffles, you'll run a fever, you feel really yucky, all of that stuff, and then after a period of time, that will pass, and you'll feel fine. And you feel fine, you don't have anything, you'll feel like, hey, I just had, a slight case of the flu or something like that, and I'm fine. But then after a while, it begins to attack the portions of, and HIV attacks every organ in your body and begins to destroy everything. But then after a while, it's going to come back and make itself known after a while. But you can stay in that remission stage for 20 years, and then it comes back. And that time it's pretty hard to figure it out. So 23 to 3 months. That test looks for antibodies using a drop of blood from the prick of your fingertip. It's about as accurate as the original antibody test, but the window period can be long, between 18 and 90 days. So the truth about the rapid test for HIV are easy and fast. They have a few questions. They're all at-home things, but one of them is an antigen test. That's where you take a prick of blood and put it on there, and it'll show you. That test, the window for that is about 18 to 90 days. The rapid oral test, you can do that. You have to swab between your gums and teeth, and you can usually tell if you have something between 23 and 90 days. This says the rapid oral test is highly effective. It's highly accurate. But if you have a new infection, even if you got it within the past few months, it's not reliable. The window is 23 to 90 days. We have a urine test now that looks for HIV antibodies, but they're not as accurate as other tests that check either your blood or your oral fluid, because it's an antibody test. Its window period is another 90 days. So, all righty then. Questions, comments, or snide remarks? None. Told y'all we were going to quit a little early. We really didn't. But I will be over to get my